Just a nurse. That's what Dr. Hargrove said when he first saw Katie Rodriguez walking the night shift at Mercy General in Raleigh. He didn't see the way her hands moved during a code, steady as a surgical laser, anticipating orders before they left his mouth. He didn't see the faded unit patch sewn inside her jacket lining, the one she touched twice per shift like a talisman, the only thread connecting her to 23 years of a life she'd buried 2 years ago. What he saw was a quiet new nurse keeping her head down, reading patient charts with obsessive detail, organizing trauma bays with mechanical precision. What he didn't see was that Senior Chief Petty Officer Catherine Rodriguez had walked away from the Navy SEALs not because she was broken, but because she was still dangerous. And that was going to be his first mistake. Katie pushed through the double doors of Mercy General's emergency department at 1:27 a.m. on a Tuesday night in February. 3 months into her tenure. 92 days of night shifts that stretched from 7 p.m. to 7 a.m., of antibiotic sharp air and fluorescent hum, of deliberately keeping her head low and her patient care obsessively meticulous. The antiseptic smell hit her first, always did, different from cordite, but her breathing exercises were the same. 4 counts in. Hold for 4. Out for 4. The muscle memory of 47 deployments ran deeper than her conscious mind, and she'd learned to live with that. The nurse's station on the 3rd floor was quiet. 2 RNs scrolled through their phones at the desk. An LPN pushed a medication cart down the hallway. Katie clipped her badge to her scrubs, Mercy General Medical Center, Katie Rodriguez, RN, license number 4782056, and moved toward her assigned section. Trauma Bay 3 needed restocking. The central supply room had been out of 14-gauge angiocarths all week, and she'd learned that anticipating the emergency department's needs meant fewer scrambles when minutes mattered. She organized the trauma bay with the kind of precision that made other nurses uncomfortable. Instrument trays arranged in order of use. Medications grouped by indication. The defibrillator pads checked and logged. Suction tubing coiled just so. A colleague from day shift, Marcus, had watched her work once and said, "Dude, are you military or something?" Katie had smiled without teeth and said, "Just detail-oriented," which was true in the way that saying the ocean is just wet is true. The night ticked forward. An asthmatic kid came in at 2:15. A diabetic with chest pain at 3:33. A fall from a ladder at 4:12, compound fracture of the left tibia, already swelling purple and angry. Katie worked alongside the attending physician, Dr. Melissa Chen, who'd learned to trust Katie's assessments after exactly 2 codes together. Chen would say something like, "Let's get an 4 in," 2 lines, and by the time she looked up, Katie had already placed both, 118 gauge in the antecubital fossa, 120 gauge in the hand, with the kind of fluidity that came from having done it 40,000 times under actual fire. But it was Dr. Hargrove who arrived for morning rounds at 6:02 a.m., flanked by 2 residents and a nursing student, that the story shifted. He was 62, maybe 63, with the kind of tan that came from golf courses in Wilmington, and he moved through the hospital like a man who'd never heard the word no. The chief of emergency medicine. 28 years at Mercy General. A reputation for high-volume patient processing and even higher billing metrics. His suits probably cost $2,000 each. His watch was a Rolex Submariner, the steel one you could buy without connections. Katie was charting in Bay 2, documenting the diabetic patient's response to insulin therapy, noting his O2 sat at 97 on room air, his glucose trending down from 347 to 212, when Hargrove appeared in the doorway. "That patient's ready to discharge," he said. Katie looked up from the computer. "His glucose just came down. Protocol says 6 hours of monitoring after insulin intervention." Hargrove's eyes narrowed. "Protocol? Right. You read a lot, don't you?" It wasn't a question. Katie kept her voice level. The charts need accuracy. She'd learned at Kandahar that the moment you showed frustration, you were finished. Control meant everything. Control meant you kept your team alive. Control meant a 23-year-old ensign didn't bleed out while you were staring at his eyes instead of his femoral artery. Hargrove moved into the bay. His resident stayed in the doorway. He picked up the patient's chart, the thick paper file Katie had updated 30 minutes prior with her handwriting clean and precise, every vitals entry color-coded, every medication notation cross-referenced, and he flipped through it with his thumb, pages rustling. "Meticulous," he said. Not as a compliment. Katie returned to the computer screen. The cursor blinked. Her typing resumed, even and calm. "How long have you been with us?" he asked. 3 months. Before that? Other facilities. She didn't elaborate. The resume she'd submitted to Mercy General had 2 previous jobs in the last 2 years, both generic nursing positions at facilities that didn't ask too many questions about why a woman with military precision patient care suddenly needed to work nights and stay invisible. Neither job had called her with references. That had been the arrangement. Hargrove closed the chart. The sound was sharp, like a door slamming. "Thorough work, Rodriguez." He smiled, but it was the smile of a man who'd just identified a problem. "Too thorough, maybe." He left. His residents trailed him out. Katie's hands didn't shake. Her breathing didn't change. But her left shoulder, the one with the shrapnel scar, the one that ached when helicopters passed overhead at night, tightened. She touched the inside of her jacket where the unit patch was sewn into the lining, just for a second, just to feel it was still there. The patch was faded blue and gold, barely visible from the outside, stitched into place by her own hands 2 years ago with military-grade thread that would outlast the jacket itself. It was the only thing that proved she'd existed as anything other than Katie Rodriguez, RN. The only physical evidence that she'd been Senior Chief Petty Officer Catherine Rodriguez, that she'd spent 23 years in the Navy SEALs, that she'd done things in Kandahar that kept her awake until 4 a.m., that she'd earned 2 Silver Stars and a Navy Cross, that she'd trained 67 corpsmen who were still alive because she'd taught them how to make decisions when there was no backup, when the LZ was hot, when every second meant the difference between living and being carried home. In a flag-draped box. Her daughter didn't know any of this. Her daughter, Emma, was 10 years old and thought her mother was just a nurse. That was the point. Katie had taken the name Rodriguez from her grandmother, moved to Raleigh, and become a ghost of the woman she'd been. The dreams had gotten better. The hypervigilance was manageable. The way her hand instinctively went for a weapon when someone touched her shoulder in public, that was mostly controlled now. Katie finished her shift at 7:56 a.m. She clocked out, changed out of her scrubs in the break room, and pulled on the jacket with the patch. The parking lot was cool, February North Carolina morning air that smelled like asphalt and distant rain. Her Subaru was parked in space 47, third row. She sat in the driver's seat for exactly 4 minutes before starting the engine, breathing through the checklist the VA therapist had taught her. Safe. Home. Emma. Safe. Home. Emma. By 7:33 a.m., she was picking Emma up from her neighbor Mrs. Chen's house, a woman different from Dr. Chen, though they both turned out to be good people, the kind who didn't ask questions. Emma was already in her school uniform, hair brushed, lunchbox packed. "Mom. You're here early." Early. Because Katie had always worked 12-hour shifts at her previous hospitals. Because she was recalibrating her life to be the kind of mother who had dinner ready, who helped with homework, who went to parent-teacher conferences without the internal sirens going off. Who was normal? She didn't know it yet, but Hargrove was already making phone calls. Not immediately. He was too smart for that. But by 8:15 a.m., as Katie was helping Emma with her breakfast, Hargrove was sitting in his office at Mercy General, reviewing the patient billing records for the past 2 years. The records that showed the difference between what he'd coded and what he'd actually performed. The phantom procedures. The inflated emergency room visits. The surgical procedures that had been billed but never completed. $738,000 in unbilled services that never happened, spread across 2 years, profitable enough that he'd bought the lake house, that he'd funded his nephew's Ivy League tuition, that he'd made the second mortgage payment on the second house in Charleston without anyone noticing. Until a nurse started reading the charts carefully. Until a new hire started cross-referencing patient documentation with billing codes. Until someone started asking questions. He didn't know who Katie Rodriguez was yet. But he knew she was a threat. And he knew exactly how to handle threats. Katie's shift that night was normal. Normal meant no emergencies, which meant time to chart, which meant time for her to notice that the patient she'd documented with a compound femur fracture at 4:12 a.m., the fall from the ladder, had been billed for an open reduction internal fixation procedure. ORIF. Surgery. Operating room. Fluoroscopy. Anesthesia. $8,000. Except he was still in the ED at 6:02 a.m., waiting for the orthopedic surgeon's consultation, and no OR had been booked. Katie made a note of it. Quietly. Just in her personal documentation, the kind of record-keeping that had kept 47 deployment cycles running smooth. Details mattered. Details kept people alive. She didn't know that one small inconsistency was already enough to make her expendable. The morning round started like any other Tuesday at Mercy General, fluorescent lights humming their mechanical monotony, the assembled residents and attending physicians clustered around Dr. Hargrove like planets orbiting a sun they couldn't afford to question. Katie pushed the vital signs cart behind them, documenting oxygen saturations and blood pressures with the precision that had kept soldiers alive in Kandahar dust. She wasn't supposed to listen, but hospital hallways carry sound like canyons, every word meant to land. "I'll bet $50 our little robot nurse here doesn't make it through the week," Hargrove announced, loud enough for the entire corridor to hear. He didn't glance at Katie, but his colleagues did. A few smiled. One laughed. Night shifts where burnouts go to hide. Watch her crack by Friday. Katie took one measured breath. Her hand didn't pause on the chart. Her face remained utterly still, the kind of composure that comes from years of watching men bleed out without flinching, from holding field tourniquets steady while explosions crackled in the distance. She had absorbed worse than mockery. She had absorbed mortar fire. This was just sound waves shaped into words by a man who didn't know what real pressure looked like. But the faded unit patch sewn inside her jacket lining seemed to press heavier against her ribs. The rounds continued. Hargrove moved from patient to patient, ordering tests that weren't medically justified, coding procedures that never happened, building his empire of fraudulent billing one faucet at a time. Katie watched the patterns crystallize in the charts like frost forming on a windshield. 17% inflation on imaging studies. Phantom procedures coded as completed. It was almost elegant in its brazenness, a system so confident in its corruption that it never bothered to hide the evidence. That afternoon, Katie sat alone in the cafeteria with a cup of coffee and a sandwich, her scrub still damp from a patient's vomitus she'd cleaned 30 minutes prior. The fluorescent lights above cast everything in a pale institutional glow. She was thinking about the patient in bed 412, a 73-year-old with pneumonia that Hargrove had coded as acute respiratory distress syndrome to justify an extra 3 days of ICU billing. Details kept people alive. They also got people killed. Hargrove entered from the opposite door. He walked past her table, his $3,200 Italian loafers clicking against the tile with the sound of consequence, the kind of confidence that comes from never having been accountable for anything. His colleagues trailed behind him, their white coats rustling like paper money. He didn't slow down. He didn't aim for her specifically. He simply brushed against her tray with just enough force, the kind of contact that could be called accidental if anyone asked, and Katie's entire meal scattered across the cafeteria floor. Coffee exploded across her scrubs in a brown wave, soaking through to her skin. Her sandwich landed face down on the tile. The room went dead silent. Hargrove kept walking. His colleagues followed, a few glancing back with expression somewhere between embarrassment and amusement. One of the surgical residents pretended to read something on her phone. The cafeteria worker behind the counter found something urgently important to do in the back. Katie knelt down without a word. She pulled napkins from her pocket, she always carried napkins, and began wiping the spill with methodical precision. The coffee had formed a dark stain spreading across the tile like a map of territory she'd already conquered in her mind. Footsteps returned. She looked up to find Hargrove standing above her, his presence somehow larger from this angle, his shadow falling across the wet floor like a sundial. In his hand was a patient chart, thick, blue, one of the ones from the morning rounds. He dropped it at her feet with deliberate casualness. "Pick that up, sweetheart," he said, his voice layered with condescension so thick it had texture. "Or is reading too advanced for robot nurses?" His colleagues had stopped walking. They turned to watch. The cafeteria worker froze mid-motion. Someone's coffee cup hovered halfway to their lips. Katie stood slowly. She was still holding the soaked napkins, her scrub staining darker by the second, but her movements carried the economical grace of someone who'd learned long ago that showing pain was a tactical error. She set the napkins on the tray, stepped over the chart without looking at it, and met Hargrove's eyes with the calm of a person who'd already survived things he couldn't imagine. A single tear traced down her cheek, not from sadness, not from humiliation, but from the accumulated weight of restraint. She wiped it away with the back of her hand without breaking eye contact, her movements deliberate, giving him nothing to celebrate. When she spoke, her voice was like still water. Like something that had passed through fire and emerged clearer on the other side. "I've cleaned up worse messes than this, Doctor." She paused, letting the silence expand like a held breath. Some of them even survived. The phrase hung in the air between them, its implications spreading outward like ripples in deep water. Hargrove's jaw tightened. His colleagues looked away. The cafeteria worker suddenly became very focused on a dish that didn't need washing. Katie picked up the chart and walked out of the cafeteria without another word, her coffee-stained scrubs leaving small wet footprints on the tile behind her like breadcrumbs from a story no one in that room was ready to read. The next 3 days became a campaign of small escalations. Wednesday's patient handoff was interrupted when Hargrove announced, loud enough for the family to hear, that Florence Nightingale here might want to focus less on overtime charting and more on basic bedside manner. The daughter looked confused. Katie said nothing, simply continued explaining the discharge medications in the same measured tone, as if he hadn't spoken at all. Thursday came with a reassignment to bedpan duty. Attitude adjustment, Hargrove had said with a smile that didn't reach his eyes. Katie cleaned bedpans with the same meticulous attention she'd given to trauma assessments, understanding that humiliation was only effective if you accepted the premise that there was something shameful about caring for the sick. She didn't accept that premise. She never had. Friday brought his final move, a formal review of her charts with the nursing supervisor, Hargrove pointing out what he called excessive documentation and overstepping scope of practice. He pulled up 5 different entries where Katie had noted clinical observations that contradicted his coding decisions. "Nursing assessment is not diagnosis," he said, his tone suggesting she was some kind of amateur. "She needs to stay in her lane." The supervisor, a woman named Patricia who'd worked under 3 different hospital administrations, simply nodded and took notes. She knew. They all knew. Nobody said anything. That Friday night, Katie sat in her car in the Mercy General parking lot for 40 minutes, her hands at 10 and 2 on the steering wheel, staring at nothing. The faded unit patch in her jacket pocket pressed against her ribs like a small weight anchoring her to a life she'd left behind. 2 years ago, she'd chosen anonymity over the nightmares that came with being someone people knew. She'd chosen a night shift in a city where nobody asked questions. She'd chosen to be invisible. But invisibility, she was learning, had its own cost. It meant watching fraud happen and being powerless to stop it. It meant seeing a system designed to exploit the sick and being silenced by a hierarchy that demanded submission. It meant being called Florence Nightingale by a man who didn't know that Reaper had walked through Kandahar at midnight, carrying a bleeding 8-year-old boy out of a firefight because details kept people alive. She drove home to her daughter's dinner plate waiting in the microwave and her 10-year-old asleep on the couch with her homework scattered across the coffee table. Katie covered her gently with a blanket, moving with the practiced silence of someone who'd learned long ago how to be present without being seen. Then she sat at the kitchen table with a cup of tea that had gone cold hours before, and waited for Tuesday. The call came in at 0300 hours. An ambulance screaming through the darkness, its siren rising and falling like something in pain. Katie was on duty, the trauma bay prepped and waiting, when the doors exploded open and the paramedics came through with a patient on the stretcher, unconscious, multiple shrapnel wounds visible even through the hastily applied field dressing on his chest, blood seeping brown through the gauze in a pattern that made her throat tighten. Navy SEAL Commander. Training accident gone catastrophic. Botched field hospital chest tube placement. Critical condition. The patient's oxygen saturation was already dropping. They wheeled him into Trauma Bay 3, the same room where Katie had assisted on cardiac arrests and post-operative hemorrhages and the small daily emergencies that filled the night shift. The paramedic gave report in that clipped, efficient tone of the profoundly exhausted, 38-year-old male, multiple penetrating thoracic trauma, initial field tube placement at forward operating base, patient became hypoxic during transport, SATS 78% on high-flow O2, BP holding at 92 systolic, we've got 2 large bore fours running wide open. Katie moved to the bedside for the initial assessment. She placed her fingers on his neck, carotid pulse strong but rapid, probably 140 beats per minute. His chest was wrapped in field dressings now, but underneath she could see the problem immediately. The bandaging on the left side was too high, the pattern of his breathing too shallow, his neck veins distending like someone had crimped a garden hose. Tension pneumothorax developing. She'd seen it 100 times in Kandahar, the collapsed lung pressing against the heart, the pressure building with every breath, pushing his body toward cardiac arrest. 60 more seconds and they'd lose him. Dr. Hargrove entered the room, already calculating, already coding. ICU admission, extended ventilator time, possibly ECMO support if they could justify the escalation. His eyes tracked toward his tablet before they tracked toward his patient. Katie's voice was steady, informational, stripped of any urgency that might trigger his defensive response. Doctor, we need needle decompression. Left side, second intercostal space, midclavicular line. Tension pneumo. We follow protocol, Hargrove said without looking at her, typing rapidly into his computer. Get him stable for imaging. Stat CT and chest X-ray. But the monitor showed heart rate climbing. 142, 145. His blood pressure was dropping, 90 now, then 88. His lips were turning blue. Katie felt her hands moving on their own, muscle memory overriding protocol, Kandahar dust still in her fingernails after 2 years of trying to wash it clean. She reached for the 14-gauge angiocath in the emergency kit, her fingers remembering exactly where to place it, but the door was still open and Hargrove was still in the room and the hierarchy was absolute and unforgiving. A young SEAL lieutenant had come through with the patient, his commanding officer, his friend. Now he stood at the bedside with his jaw clenched, watching the monitor numbers fall, watching his commander slip toward something irreversible. He gripped Katie's arm. His voice was barely a whisper. Please. Whatever you can do. The patient's lips were turning the color of a bruise. Hargrove left the room to check on the CT schedule. The trauma tech was charting. The monitor continued its descent toward flat line. And Katie Rodriguez, who'd spent 2 years becoming invisible, who'd chosen anonymity over legacy, who'd carried a faded unit patch in her jacket lining like a secret she'd buried in her own chest, Katie made a decision that would end her career at Mercy General and resurrect everything she'd spent 2 years trying to leave behind. She reached for the decompression kit. Her hands knew what to do. Some things you never forget. Some skills run deeper than time or distance or the desperate human desire to be someone new. The hiss of air escaping. The patient's oxygen saturation climbing, 68. 72, 78. Back to 88. His heart rate dropping. His blood pressure stabilizing. Sinus rhythm. Breathing. The stretcher came through the ER doors at 3:44 p.m. on a Tuesday with blood already pooling beneath the transfer blankets. The commander had made it out of the field hospital in Kandahar alive, which was more than the medics there had expected when the IED detonated 42 minutes earlier. 2 shrapnel wounds to the left chest wall. 1 collapsed left lung. A pneumothorax that had been partially managed with needle decompression in the field, but the transport had jostled him, and the lung had recollapsed somewhere over the Atlantic during the medical evacuation flight. Now he lay on Katie's stretcher, grey-faced and gasping, while the young SEAL lieutenant who'd accompanied him gripped the rail like it was the only solid thing left in the world. Katie saw him the moment the stretcher rolled past the trauma bay windows. Saw the way his chest was moving, one side rising, the other locked. Saw the tracheal deviation, that subtle shift in his windpipe that meant pressure was building on the left side of his chest cavity, squeezing his heart, killing him slow and silent in a room full of doctors. She was charting vitals for a discharge patient when the monitor alarm started screaming, and her eyes snapped to the second bay where Dr. Hargrove was already moving, already calling orders like a man who'd learned medicine from a billing code manual instead of from the dead. Get him on continuous pulse ox. Establish 2 large bore 4s. I'm ordering a CT chest with full contrast, Hargrove announced, his voice carrying the absolute certainty of a man who had never been questioned, never been wrong, at least not in front of witnesses. We need imaging before we proceed with anything invasive. Katie watched from the hallway. Watched the respiratory therapist, Marcus, lean over the patient and note what she'd already noted: the breathing was becoming more labored, more desperate. The oxygen saturation was dropping in real time. 94%. 92. 90. The kind of drop that didn't stop on its own. The kind that ended with a patient flatlined on a table while everyone stood around waiting for a CT machine to finish its spin. She moved to the trauma bay window. The commander's face had taken on that waxy, desperate quality she'd seen before, in Kandahar, in the back of a Black Hawk helicopter, in the faces of men whose bodies were betraying them faster than medicine could catch up. His lieutenant was saying something, pleading something, but the words were drowned out by the alarm that wouldn't stop. Katie's nursing instincts fired like muscle memory: tension pneumothorax. Textbook presentation. And textbook treatment for a tension pneumothorax wasn't a CT scan. Textbook treatment was a needle. 1 puncture. 14-gauge angiocath needle through the second intercostal space, mid-clavicular line, and the trapped air would hiss out like a pressure valve, and the patient would live instead of coding. She could do it in under 90 seconds. She'd done it in worse conditions with worse equipment while rounds whistled overhead. But Dr. Hargrove had already made his decision, and in the hierarchy of a hospital, especially Mercy General where Dr. Hargrove had cultivated relationships with 3 board members and a hospital administrator, his decision was law. Katie approached the supply cabinet where the needle decompression kits were stored. She knew exactly where they were: top shelf, left side, next to the chest tube trays. She restocked them every shift. Sometimes twice a shift when the trauma cases stacked up. Her hand moved on its own, reaching for the cabinet door, because something deeper than protocol was speaking now. Something that had spent 23 years in the Navy SEAL teams learning that the fastest response to an emergency was the one that saved lives, not the one that maximized billing. Ms. Rodriguez. Hargrove's voice cut across the bay like a blade. He was already moving, positioning his body between her and the cabinet with the kind of deliberate precision that told her this wasn't accidental. This was strategy. This was a man who'd already calculated what would happen if she succeeded, and he'd decided the outcome wasn't worth the loss of an extended ventilator stay. Step back. I've already called for CT transport. The machine will be here in 6 minutes. The patient's oxygen saturation hit 84%. Then 82. The monitor alarm was screaming its electronic warning, and Katie could see the commander's ribs beginning to work in that frantic, insufficient way that meant his body was using every last resource to try to pull oxygen from air that wasn't reaching his lungs. Katie made a decision that took 3 seconds. She turned away from the cabinet, walked to the nursing station where Marcus was coordinating with respiratory therapy, and leaned close enough that only he could hear. Call another physician for a second opinion on the CT necessity. Tell them it's urgent. It bought her 90 seconds. Maybe 2 minutes if Marcus knew how to make the call sound official enough. She used those seconds to walk back toward the trauma bay, to approach Hargrove, who was now updating the patient chart with the satisfied expression of a man who'd made a diagnosis that would generate maximum reimbursement. Her voice was level when she spoke, pitched low enough that the lieutenant wouldn't hear the steel underneath. Dr. Hargrove, I need to document the patient's current respiratory status. Hargrove smiled. Actually smiled. Of course. Chart whatever you need. He believed he'd won. Believed he'd blocked her, stalled her, and that the institutional weight of his position would keep her compliant until the CT was done and the moment for intervention had passed. He turned back to his documentation, one hand braced against the patient monitor. Katie had seen that smile before, on the faces of men who'd never understood that the quietest person in the room was usually the one holding all the leverage. The patient's oxygen saturation hit 80. The alarm was a continuous scream now. The young SEAL lieutenant was standing up, hand shaking, saying something about "Sir, you need to breathe, sir," and the commander's grey face was turning a shade of purple that Katie had seen exactly once before in her nursing career, and that patient had coded 17 seconds later. Katie moved to the supply cabinet. Her hand was steady. Her breathing was steady. The part of her that had moved through Kandahar at midnight with a bleeding child in her arms and hostile fire snapping the air around her head recognized this moment for what it was, a ticking clock. 5 minutes. Maybe less. Cardiac arrest. Cardiovascular collapse. Death from a condition that had one treatment, and that treatment was locked behind a door and a doctor who decided profit was worth more than a human life. She opened the cabinet. Removed the needle decompression kit, the plastic package containing one 14-gauge angiocath needle, pre-assembled, ready to penetrate. Held it in her hand for exactly 1 second. Hargrove turned. Saw. Moved with the speed of a man who'd suddenly realized his calculation had been incomplete. He positioned himself directly in front of her, his body a barrier between her and the patient, his hands raised in what might have looked like a gesture of reason if his eyes hadn't been full of calculation and fury. "Ms. Rodriguez, you are overstepping your scope of practice. I am the physician on this case." The patient's oxygen saturation hit 78. The monitor alarm was so loud it seemed to fill the entire emergency department. The commander's hands were gripping the stretcher rails hard enough that his knuckles had gone white. Katie felt something shift in her chest. Not fear. Not anger. Something older and deeper and far more dangerous. It was the feeling she'd had 20 years ago when she'd assessed a collapsing building in Kandahar and realized a child was still inside it. The feeling that transcended rank, protocol, and consequence. The feeling that some things mattered more than protecting yourself. She crossed the room in 3 strides. Put herself between Dr. Hargrove and the patient. And spoke in a voice that wasn't a request, was never a request, was an order dressed in words a civilian hospital could theoretically argue about if they wanted to get sued when this patient died. "Get out, or I lock this door and do my job." Hargrove laughed. The sound was brittle and desperate and too loud. "You'll be terminated before he's intubated." Katie's hand was already moving toward the trauma bay door. She didn't look at Hargrove. Didn't look at the lieutenant. Just kept her focus on the patient, on the gradient of gray in his skin, the trapped air in his chest cavity, the 5 minutes ticking down to something irreversible. Her hand found the lock. "I've been terminated before, doctor." "He hasn't died before." "Not on my shift." The click of the lock was the loudest sound in the room. For 1 second, nothing moved. The alarm continued screaming. The monitor beeped its electronic countdown. The SEAL lieutenant stood frozen with his hand still gripping the stretcher rail. And Dr. Hargrove's face moved through a progression of colors that would have been interesting to observe if the patient wasn't turning purple fast enough that Katie could actually see the change happening in real time. The needle was already in her hands before Hargrove finished his first threat through the glass. 14-gauge angiocath, the same gauge she'd used 2 decades ago in Kandahar when a staff sergeant took shrapnel in the chest cavity and the nearest surgeon was 14 minutes out by helicopter. Muscle memory took over. Her fingers found the landmarks on the commander's chest wall like they'd never stopped finding them, second intercostal space, mid-clavicular line, left side. The anatomy didn't change. The fear didn't either, but fear was just information, and Katie had stopped listening to fear in 2003. Unauthorized procedure. Hargrove's voice cracked against the glass. That's immediate termination. You understand me? Security is all ready. Katie didn't look at him. The SEAL lieutenant had one hand on the commander's shoulder, steadying him, and his eyes met Katie's for exactly 1 second. Long enough for her to see that he recognized what she was doing. Long enough for her to see him recognize her star. Not who she was, just what she was. Someone who moved with the terrifying fluid precision of a person who'd trained for exactly this moment under circumstances that would have broken most people into pieces. The skin over the second intercostal space had already begun to show the mottled purple of hypoxia. The commander's lips were moving from pink to slate gray like a timer counting down. His chest wall wasn't moving anymore. The collapsed lung meant his entire right side had become a vacuum, and the vacuum was pulling his heart sideways in his chest cavity like a hand slowly closing around it. Katie prepped the site with one motion. Alcohol swab. The sharp smell of antiseptic cut through the stale hospital air. No trembling. No hesitation. Just the knowledge of exactly where to insert the needle and exactly why. At the second intercostal space you avoid the nerve and artery running along the rib below, and if you miss those anatomical landmarks by even a centimeter, you're the person who taught a SEAL to bleed out faster. I'm calling this into every regulatory board in North Carolina, Hargrove was shouting. His fist hammered against the glass door. You'll never work in medicine again. I'll make sure of it. Step back from that patient. It wasn't a request. It was a threat. Katie heard it the same way she heard background noise in a trauma bay, registered it, filed it, and kept her hand steady. The needle slid in. Second intercostal space, midclavicular line, perpendicular entry at 90 degrees. The resistance changed as she penetrated the chest wall, muscle and fascia giving way, and then the hiss of air escaping. Not metaphorical. Not theatrical. The actual physical sound of compressed air rushing out of a collapsed lung space, the sound of pressure equalization, the sound of a human body suddenly able to breathe again. The SEAL lieutenant's grip on the commander's shoulder tightened. His eyes closed for half a second like he was praying, and maybe he was. Katie secured the catheter with the same precision a surgeon uses closing a vein, and the respiratory therapist, a woman named Jen who'd been watching from the corner with her hands pressed to her mouth, whispered something that might have been Jesus Christ or might have been a prayer or might have been both. The oxygen saturation monitor began to climb. 85%. 88. 91. The numbers ticked upward like a countdown timer running backward, like a reprieve, like mercy expressed in single-digit increments. Heart rate dropping from 145 to 120 to 110. The commander's chest wall expanded with the first real breath he'd taken in 17 minutes. Color blooming back into his lips like someone turning up the brightness on a dying photograph. That's... Hargrove's voice had changed. The rage was still there, but it had curdled into something else. Something that sounded like recognition that he'd lost control of the room. That's gross insubordination. That's violation of chain of command protocol. That's... Katie withdrew her hands and stepped back from the patient. Her own hands were completely still. The kind of still that comes from having done this before, from having saved lives when the alternative was watching them end. She looked at the monitor. Looked at the commander's expanding chest. Looked at the SEAL lieutenant's face, which had gone from terrified to something that looked a lot like awe. Only then did she unlock the trauma room door. Hargrove stood on the other side of the threshold, his face the color of a burgundy wine that had been left to ferment in rage. His eyes were narrow, his jaw clenched so tight she could see the muscles working at his temples. He looked like a man whose entire architecture of control had just been demolished by a nurse with a 14-gauge needle and muscle memory from a war zone. "You're finished," he said quietly. The quiet was worse than the shouting. "You understand? You're finished here. That was an unauthorized procedure performed outside the scope of your practice. That was assault on a physician. That was..." He pulled his phone from his pocket with a shaking hand. "That was the last mistake you ever make at this hospital." By noon, they came with the cardboard box. Security arrived with a supervisor Katie had never seen before, a man with the bureaucratic effect of someone trained to handle terminations without making eye contact. He carried the box like it might contain something explosive. Katie was packing her personal belongings, the spare scrubs, the protein bars, the copy of Coulter's Manual of Nursing that had been her only textbook for 3 months, when she overheard the second phone call. Hargrove in his office, his voice carrying through the half-open door. "Yes, I need to speak to your director of nursing. This is Dr. Hargrove from Mercy General in Raleigh. I'm calling regarding one of your former employees." A pause. "Catherine Rodriguez." "Yes, that's correct. She worked with you for how long?" 14 months. Another pause, and Katie could hear the change in Hargrove's voice, the shift into his reasonable, concerned voice. The voice he used when he wanted to sound like he was protecting patients. "I'm concerned about a pattern here. Patient safety issue. Actually, several patient safety issues. Concerning judgment. Lack of deference to physician authority. Does that sound familiar? Did you have similar concerns?" Katie's hands were steady as she wrapped her stethoscope around the cardboard box's lip, securing it. But something in her chest was moving differently. Something that felt like a door closing. Something that felt like the moment right before a building collapses, that moment where you can still breathe but you know the oxygen is running out. By 2 o'clock, she was standing in the parking lot of Mercy General with a cardboard box in her hands and the knowledge that Dr. Hargrove had called in 3 board members he'd cultivated over years of golf games and campaign donations. They were meeting right now in the administrator's office. They were reviewing her file. They were discussing patient safety and unauthorized procedures and the phrase that kept appearing in the documentation, gross insubordination. By 6 o'clock, she was sitting at her kitchen table with a packet of termination paperwork spread before her like a jury's verdict, written in the language of human resources. Immediate termination for gross insubordination and unauthorized medical procedures outside the scope of nursing practice. Ineligible for rehire. A recommendation to the state board that her license be reviewed for violation of protocols. By 8 o'clock, she was crying. Not the way she'd cried in the cafeteria years ago, silently, without breaking eye contact. This was different. This was the kind of crying that comes when you've been holding yourself together through an entire career of decisions that cost you pieces of yourself, and then you save a life the way you were trained to save lives, and it costs you everything else. Tears on the paperwork, making the words blur. One hand pressed against her chest like she could hold that door shut, hold that building up, hold herself in one piece. Her daughter appeared in the doorway in pajamas, the flannel ones with the tiny sailboats, rubbing her eyes. Emma was 10 years old and had learned not to ask too many questions about Mommy's job because the answers made Mommy sad. But this was different. This was Mommy home at 8 o'clock on a Tuesday night, crying at the kitchen table like the world had ended. "Mommy." Emma's voice was very small. "Why are you home early? Why do you look so broken?" Katie looked at her daughter. She tried to find the words, how to explain that doing the right thing can be exactly the same as destroying yourself. That saving a life can cost you everything else. That the people who should recognize what you've sacrificed are sometimes the exact people who'll bury you for it. That heroism and unemployment are sometimes the same thing, just depending on who's counting the cost. She had no words left. All she had were hands that had held lives together, a daughter who was watching her fall apart, and the knowledge that somewhere in this hospital, a SEAL commander was breathing because of her, and nobody would ever know the price she'd paid for that breath. What she didn't know was that in 3 days, everything would change. That the person she'd saved would wake up and see her name on a chart and understand exactly who she was. That recognition would move through the hospital like a shockwave. That federal people would get involved. That the entire architecture of power that Dr. Hargrove had built would start to crumble, and this time, it wouldn't stop crumbling until there was nothing left but a man in a cardboard box of his own, escorted out the same doors where Katie had been escorted out, carrying the same sense of irreversible loss. But that night, Katie just sat at her kitchen table with her daughter, without words, without answers, and without knowing that the world was about to remember exactly who she was. 3 days later, the monitors in the ICU hummed their steady rhythm while the commander's eyes flickered open like a man surfacing from deep water. Sedation wore off in layers, consciousness returning in fragments, the ceiling tiles, the fluorescent glare, the ache in his chest where shrapnel had lived until Katie Rodriguez's hands had pulled him back from the edge. A nurse chart hung at the foot of his bed. Just a chart. Just a name. Catherine M. Rodriguez, RN. He stared at it the way a man stares at a ghost. One word escaped his lips, barely audible, a whisper that carried the weight of 2 decades, Reaper. The young SEAL lieutenant standing watch at his bedside snapped to attention. So. The commander's hand moved toward the chart with the precision of someone who'd spent his entire adult life reading intelligence reports, identifying patterns, connecting names to faces to operational history. Pull her file. Now. The lieutenant's hands trembled as he logged into the encrypted system, his fingers moving faster than protocol allowed, the screen illuminating his face as the data populated. Senior Chief Petty Officer Catherine Margaret Rodriguez. 23 years of service. Combat operations spanning 3 continents. 2 Silver Stars. A Navy Cross. Training record showing she'd personally instructed 847 active duty corpsmen in field medicine over her career. The lieutenant's breath caught. He looked at the commander, then back at the screen, then back at his commanding officer. That's not possible. She's a civilian nurse. The commander's jaw tightened. Read the service photo. The lieutenant did. Same face. Same woman. 10 years older, unmarked by uniform, working night shifts in North Carolina while the military she'd served had let her disappear into anonymity. Get me the board. Everyone. Now. By 6:02 p.m., the hospital conference room held 8 board members, 3 administrative staff, 2 hospital lawyers, and the commander, still moving like a man operating through pain medication and pure willpower. His voice carried the tone of someone accustomed to being obeyed without question. Senior Chief Petty Officer Catherine Rodriguez pulled me from a collapsed building in Kandahar when I was 8 years old. I was bleeding out. She was 24. She stayed with me until a medevac arrived, kept me talking, kept me alive, then went back in for 2 other civilian children. The board members exchanged confused glances. None of them understood what they were hearing. The commander continued, each sentence a hammer strike. She earned 2 Silver Stars in combat operations. She earned a Navy Cross for actions that remain classified. She trained approximately half the corpsmen currently serving in forward operating bases. He paused, letting that weight settle. And your chief of emergency medicine fired her for saving my life. The general counsel opened his mouth. Sir, regarding the unauthorized procedure and hospital protocol, the commander cut him off with the kind of silence that made fluorescent lights seem loud. Protocol that deliberately delayed treatment to inflate billing codes. I read her chart. Her documentation is cleaner than a Pentagon audit. Every procedure she documented was necessary. Every code Dr. Hargrove built was phantom. The FBI liaison assigned to the commander's security detail sat near the back of the room, taking notes. When the commander finished speaking, the liaison excused himself and stepped into the hallway. He made 1 phone call. 30 seconds. That was the entire conversation. 40 minutes later, 3 federal vehicles pulled into the Mercy General parking lot. By 8:15 p.m., forensic accountants in dark suits were carting away filing boxes from the administrative office. By 9:19 p.m., the hospital's chief operating officer was on a video call with the Department of Justice's Medicare Fraud Division. By 10:08 p.m., Dr. Hargrove's office had been sealed with evidence tape the color of authority and consequence. The nursing supervisor who documented Katie's violations, the ones Dr. Hargrove had fabricated, sat across from a federal investigator and saw the evidence laid out like a prosecutor's closing argument. Phantom CT scans. Ventilator time overcoded by 340 hours across 6 months. Imaging center referrals that triggered kickback payments to a shell corporation registered to Hargrove's nephew. 12 patients billed for procedures they never received. Katie's detailed charts, the ones Hargrove had mocked as obsessive, were now Exhibit A in a fraud investigation. They proved what she'd documented. They proved what he'd billed. They proved he'd lied. The supervisor's hand shook. She'd believed him. They all had. And they'd helped him. The hospital's general counsel was mid-sentence about Katie's breach of protocol when the FBI liaison interrupted, his voice level and precise, the breach of protocol that saved a Navy SEAL commander's life while your chief of emergency medicine was deliberately delaying care to inflate billing. That breach. The lawyer's mouth closed. The room understood what was happening. This wasn't a personnel matter anymore. This was a federal investigation. This was the kind of thing that ended careers, not saved them. By midnight, Dr. Hargrove sat in a lawyer's office, learning what 15 years of careful manipulation looked like when examined by federal accountants. Medicare fraud. Potentially manslaughter, depending on whether they could connect billing delays to patient deaths. His medical license would be suspended pending investigation. His network of board members was dissolving in real time, each one calling their own attorneys, each one discovering they'd been complicit in fraud they didn't understand. His golf buddies weren't taking his calls. The hospital administrator who'd cultivated him for years issued a statement about zero tolerance for fraudulent billing practices and full cooperation with federal authorities. The outside investigator who'd helped him document Katie's violations withdrew the report with a single email, conflict of interest identified. Immediate withdrawal of services. Everything he'd built in 15 years was collapsing in 15 hours, and the woman he'd called just a nurse was the rock it was breaking against. The same security guard who'd handed Katie her cardboard box, the one with her belongings, her shame, her termination papers, stood at Dr. Hargrove's office door the next morning with an identical container. The federal evidence tape had been removed. The door was open. The guards made space. The security guard's voice carried barely concealed satisfaction. "I believe you know the way out, Doctor." Hargrove left. He didn't speak. He didn't argue. He simply took the box and walked past the people he'd dominated, past the staff he'd humiliated, past the evidence of his own choices being loaded into federal vehicles. His attorney would inform him later that a trial date was being set. His defense would be impossible. The documentation was too clear. The fraud was too extensive. 6 months from now, he'd be teaching CPR to community college students for minimum wage, his medical career a memory, his freedom measured in the time until sentencing. 6 months later, Katie Rodriguez stood in the break room of the VA hospital across town, adjusting the fit of her new scrubs, navy blue with a VA emblem stitched precise and clean. The administrator had personally recruited her after the commander made one phone call to the right general. Her job was real. Her credentials were real. Her expertise was finally, visibly, undeniably real. The news had carried stories about Mercy General's fraud investigation. About the phantom procedures. About the billing scheme that had generated $847,000 in fraudulent claims over 7 years. About the chief resident who'd blown the whistle and been terminated for it. Katie's name wasn't in the articles, the legal settlement prevented that, but the story was clear enough for anyone who wanted to understand it. The good nurse had won. The system had failed. And someone had finally paid for it. At 3:15 p.m., the commander walked through the front doors of the VA hospital on his own power, his chest healed, his strength returned, his recovery ahead of schedule because someone had cared about healing instead of billing. The bandages were gone. The pain medication was down to as needed. He moved like a man relearning what his body could do. Katie stood near the entrance, waiting. She'd known he was coming. The commander's eyes found her immediately, the way they always had, the way they always would. He stopped 10 paces away. The salute came without thinking, the kind of movement that lives in muscle memory deeper than conscious thought, sharp, crisp, the angle perfect, the respect absolute. Katie returned it the same way, and realized in that moment that she'd stopped hiding who she was. The faded unit patch in her jacket lining wasn't a secret anymore. It was just part of the story. Thank you, Senior Chief. Again. His voice carried the weight of both rescues, both moments when her hands had been the difference between life and whatever came after. Katie allowed herself a small smile, the first genuine one in months, her voice steady and quiet. Just doing my job, sir. Both of them. He nodded, not the formal nod of a superior acknowledging a subordinate, but the nod of a man saying goodbye to someone who'd defined his life twice over. He turned and left, back into the world, back into the life Katie's hands had secured for him. In the lobby, her 10-year-old daughter sat at a table doing homework, old enough now to understand why Mommy had cried that night, young enough to still believe her mother was invincible. Katie walked toward her, the VA scrubs bright in the afternoon light, the weight of vindication settling into her shoulders like armor that finally fit. 3 new admissions were waiting. 3 new lives that needed what Katie had always known how to give. She went to work because that's what heroes do when the world stops watching. They show up. They care. They save lives in the dark, knowing nobody will ever call it heroic, and they do it anyway. Heroes walk among us. Sometimes in scrubs, saving lives in the dark. If you've ever stood up to a system that tried to break you, subscribe and let us know your story in the comments. And if you believe healthcare needs more people like Katie Rodriguez, share this video. The next whistleblower might be watching.